Alright guys, so for today we're going to be looking through the DHS tray, that's the dynamic hip screw tray. What we'll do first is go through some of the instruments, explain their uses, and then go through the order that you'll probably use them in. So starting on the top tray, we've got our wire guide. That's an angled guide for the guide wire. You've got the guide wire measurer to tell the surgeon what length the lag screw needs to be. Now here you've got two types of barreled reamers, triple barreled reamers as they call them. One of them says DHS short on it. Now we never use this unless specifically asked. So again, never use the short unless specifically asked. Your standard reamer, triple barreled reamer as they call it, will be this one. And it simply says DHS on it, okay? We'll put that together in a minute, but remember, normal standard DHS reamer, never the short one unless specifically asked, okay? To put this together, we take your reamer. Now this reamer has got numbers on it, and depending on what length the surgeon has requested depends on the length that you set this to. To set this up, you take the standard reamer that just says DHS on it. It goes from top to bottom. Give it a bit of a wiggle because sometimes it won't come through, and then you'll feel it coming out the other side. You'll also hear the clicks. Okay, so the clicks on here will tell you what size you're going to be reaming to for your lag screw. So if your surgeon says it's measuring 90, I want to ream to 90, you set it to 90 on here, on the numbers. You take your nut and just screw it on. Sometimes you'll find that the nut won't attach, and that's because it's not sat in these little cleats properly. So make sure that your reamer is sat perfectly in the cleat, otherwise you'll struggle trying to get the bolt on, okay? Again, before you hand it to your surgeon, show it to him that it's on set to 90 as requested, or whatever length he wants his lag screw to be reamed to. This does go on power. It has the trauma attachment, which we'll go through a little bit later on. Moving through to the bottom tray, we have got the attachment for your angled guide. So this will be one of the first things that the surgeon uses. It actually gives you the angle into the femoral head, which allows the plate to sit onto the lag screw. I'll show you some demonstrations in pictures. So what happens is this pushes forward on the T-handle, and that just connects like such. And that's ready to go. Your surgeon will require the guide wire, which is a 2.5, and also a wire driver with this. So you want the wire driver, and your angled guide. Once he's measured, like say, we've done the reaming for the lag screw, happy days. Then we're actually going to be putting the lag screw in. So from our circulator, we'll get a lag screw. It will look something like this. It's us together. We have got two instruments that come from the bottom tray. They look like this. This bit goes into there like that, which you'll see that there are two almost flanges on the top of here, and there's impressions into here. If it fits, it sits. Pop that into there. Easily just screw the top. Try not to over thread it. And then you'll find now that your implant and your instruments are now locked together. So, how to insert this? Your surgeon will need this, and he will also need a T-handle and an oversleeve. Put the oversleeve on first, over the T-handle. Take your lag screw and drop it down the tip of the T-handle. Give it a bit of a wiggle until you feel it drop. Once it's dropped, it's ready to be given to your surgeon. Now, after he's done his lag screw and he's happy with the positioning, they're going to be wanting to put in a plate. Now the plate, I don't have one to show you, which is kind of annoying, but you will need a impactor, which is this one, and a mallet from your instrument tray. This also, if you find that this is damaged, it can be removed and replaced. So for impaction for the plate, you need your white tipped impactor and a mallet. Duck, 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 duck. Now, once your plate is on and the surgeon's happy, you're going to be moving along to fixing the plate with the screws. So you'll need a 3.2 drill bit for the 4.5 screws. You will need a tissue guide, which universally look like these. They also have indications of the size of the drill that it can go through. On here it says 3.2, and here as well it says 3.2. So if it's not meant to go there, it won't tend to go through. If it's too small, it'll rattle. If it's too big, it won't go through. Then once the surgeon's drilled, he will need to measure the distance. This is your measurer. It tells the surgeon here what length of screw he will require. Once you've got the screw from your circulator, there are two different ways to affix the screws to the plate. You can do it by hand, which is the screwdriver, or you can do it by power, which is by using the same attachment screwdriver, but it just has a quick coupling attachment or AO attachment that will go onto the power drive. Very rarely do they ask for this, but in case they do, you know it's here on the top. A quick overview, things that we're going to need in order. So first thing, we're going to be excising, retracting, getting down to the fracture itself, clearing away any unnecessary tissue and unwanted tissue. We're going to be using the angled guide or the wire guide. Once the surgeon is happy, he will then use the measure, which will indicate the length of the lag screw. We then set our reamer to the length that the surgeon requires to ream it to, usually the length of the lag screw, but always double check with the surgeon that he wants to ream to his measurement. The next thing is the lag screw insertion. Put it together as shown. Have your T-handle. Drop down the T-handle. Wait for that little clip. Hand it to your surgeon. Once the lag screw's in, we'll then be moving on to our plate, which is when we need our impactor and our mallet, and the plate, obviously. Once the plate's on, and we've done our x-rays, the surgeon will then need to drill, measure, screw. So we've got a drill guide, our measurement, and our screwdriver. Then we're done.